If you are a cancer survivor, you know the struggles that bowel movements can present to you. They're either moving too fast and like liquid, or they're moving too slow and they're like rabbit pellets. In this video, I go through a massage technique that can address both of these issues. Hi, my name's Dr. Laura, and on this channel, I help you gain optimal health through knowledge and movement. As a pelvic floor physical therapist, I see many types of cancers that affect the reproductive system, urinary system, digestive system, and bowel system. Oftentimes, to treat these cancers, patients have to go through chemotherapy, radiation, or surgery. And the side effects oftentimes are loose or hard stools. So as the patient, you are usually left with taking some type of over-the-counter medication to either speed things up or slow things down. Well, I'm here to tell you there is an alternative solution with this amazing massage technique known as the colic flexure massage. As you can see in the screen next to me, the colon is actually an upside down U. It has the ascending part of the colon, which is on the right side of our body, the transverse colon, which goes from the right side of the body to the left side of the body, and then the descending colon, which is on the left side of the body. It's important to remember this as we dive into the massage technique a little bit later. For me, that tends to be in a partially reclining position or even laying flat in my bed with my knees slightly elevated and supported. For the purposes of this video, I'm going to be demonstrating in a standing up position, and I'm actually going to have my abdomen sectioned off into 4 quadrants to help as I explain things. As I stated, I have divided my abdomen into 4 quadrants. We have our upper quadrants and our lower quadrants. First, we're going to focus on speeding things up. You want to start on the right side of your body, as this is where the ascending colon begins. Using the pads of your fingers, you can use one hand or both hands. I'm going to demonstrate with one hand, making a 45-degree angle with your finger pads and your abdomen so that you're not coming in straight on and that you're not coming in flat. You're going to find your pelvis bone, specifically as it comes down into your groin, and then you're going to move just on the inside where it's nice and soft. Here, keeping a moderate level of pressure, you're going to go ahead and do a clockwise circle motion. You're going to do 10 of these as you do nice, slow, deep breathing. Remember, because I'm videoing this, my clockwise motion might look counterclockwise to you. The reason why we do this clockwise motion is because we are encouraging things to move through the ascending, transverse, and descending colon. We're trying to speed up the process. From the right lower quadrant, you're going to move up to the right upper quadrant. Again, you can find the angle of your ribs, come into this nice soft area. This is where your colon takes a turn. And again, doing a clockwise motion, you're going to do 10 slow circles. It's important to note that as I'm doing this, I'm not gliding my hands over my skin like I'm putting on lotion. I'm actually sinking into the tissues, keeping that 45-degree angle, and then moving in a circular motion. We will continue this massage technique in the left upper and lower quadrant, always going in the clockwise direction, using the same bony landmarks that I talked about on the right side. Now, we're gonna go ahead and do the reverse for when we want to slow that motility down and make our stools go from loose to more formed. Next, you're going to move to your left upper quadrant, pads of your fingers, 10 circles, and finally, your left lower quadrant, 10 circles. That completes how to get things to speed up. When we are trying to slow things down, we want to actually do the opposite. So we're going to start on the opposite side, so where our descending colon is, so on our left lower quadrant, and instead of going in a clockwise direction, you're going to want to go in a counterclockwise direction. Remember, you're using moderate pressure. Always find your bony landmarks of your pelvis and then go just on the inside of that. When I have more stool in my system, I tend to feel a fullness or even a tenderness here. So don't push to where there's pain or discomfort. Really change your pressure for what your needs are. Then move to the left upper quadrant in a counterclockwise direction using the ribs as a guide. Go ahead and do a nice circle motion 10 times. Then you're going to the right upper quadrant and finally the right lower quadrant. Start with either of these techniques 3 times per day. Based on your symptoms, you can either increase or decrease your frequency. Consistency is always key. And remember that successful completion of this technique relies heavily on your ability to do diaphragmatic breathing. In the screen next to me, I have shared my favorite diaphragmatic breathing video where I go through exactly how to make sure you're doing it correctly, and then we do a guided diaphragmatic breathing class together. So click that video and I'll see you over there.